Hello, my name is Rebecca Flowers. I've been an occupational therapist with specialty in pediatrics and in a neurological frame of reference called sensory integration for almost 35 years. I say that by way of telling you that I've had a lot of experience with working with babies and children. And within 4 years of graduation as an OT, I discovered another tool to add to my toolbox of knowledge that has helped me tremendously over the years. It's called CranioSacral Therapy. It's out of the osteopathic community, and it was brought to us, it was popularized in the 1970s, the early 1970s, by Dr. Upledger. It is the craniosacral system that we're going to be talking about is the one system in the body that houses the entire central nervous system. So we're talking brain, we're talking spinal cord. And that being said, there's very little in terms of problems that we have physically as well as socially, emotionally, because all of those things are brain function too. So there's very little that cannot be helped by craniosacral therapy. The premise of craniosacral therapy is that if we mobilize the bones, which, by the way, Dr. Upledger with his team of researchers at Michigan State in the 70s proved there is movement that continues through the lifespan of all of the different bones at the sutures. That's what these wiggly, squiggly lines are called. That movement and that system, that membrane system, is continuous all the way down to the tailbone. And it's continuous from the meninges lining the skull through the hole in the base of the skull all the way down. So let's talk about orthodontia and what role does craniosacral therapy play in orthodontia? Well, for starters, let's think about different causative factors of the need for orthodontia. Many times you'll see a heredity component. The child may have teeth that are bigger than what the mouth allows for. That's what they've inherited. Many times you'll see a situation in which there is an underbite of the jaw. So rather than sitting with a nice occlusion, that jaw sits forward. That's oftentimes hereditary too. Sometimes that can be induced by position in utero. But irregardless, when braces are placed on the teeth, and nowadays things are quite different than they used to be. Back 49 years ago, when my oldest son got his braces, and then his younger brother following that, they had inherited my mouth structure, unfortunately. So when they got their braces, the banding would come across, and it would be uppers and it would be lowers. Now they're still doing that, but they're now doing lots more. They're now doing what they call expanders of the upper palate, which is better seen from the bottom. So now we're talking about going across the roof of the mouth and expanding the maxillary bone, all right, so that it allows for more space for those teeth. And oftentimes that goes a long, long way to get to the point the orthodontists are concerned about what we call the occlusion, how the upper and lower jaw come together. Well, Why do you need craniosacral therapy? Years ago, when I had my own clinic in the Midwest, I had dentists from far away, 52 miles away, that would refer for craniosacral therapy and or massage and or physical therapy before they put the braces on the teeth. Why? Well, to explore that, let's take a look over here at the craniosacral system. Again, that system includes the meninges, the lining of the skull, continuous with the membrane sac holding the spinal cord, all the way down to the tailbone. It's a full body system that influences and is influenced by communication back and forth between brain and body. So, if we have any abnormal tension patterns in the body, we need to release those first. Many times, the reason this work is called craniosacral, cranium is the head, sacrum is the bottom part of the spine, and it looks like an upside down triangle with the apex of the triangle being the tailbone. When we look at that, if there is any kind of imbalance in the pelvis, even an eighth of an inch, there can be some rotation. That's going to influence the bones in the head. What we know from craniosacral therapy is that the hip bones here mirror the temporal bones here. And the sphenoid that can be seen deep into the back of the orbs of the eyes can also be seen in the temples, can also be seen and palpated from inside the mouth. It looks like a butterfly if you look down here. This is looking at the skull from a top-down sort of a position, just like that. Okay? So, in looking at that, it's this juncture between what looks like a butterfly, it's the sphenoid, and the base of the skull, the occiput, right here on the model. That's the primary joint. It's not really a joint, it's a synchondrosis, but nevertheless coming together of two bones within the head. Because this bone, this butterfly bone, which is mirrored by the entire sacrum, if it's tilted to one side, it's going to have the sphenoid tilted the other way. We learn in craniosacral 2 all the different ways that that junction can be distorted. And we learn how to mobilize the bones, and by mobilizing the bones and releasing restriction there, we can then mobilize the underlying membrane system so that the body can have more movement, more motion, and it frees up patterns that have kept us stuck. Well, now, what if we come across the entire, this is called the maxilla, the upper jaw. It's actually two bones with a suture down the midline. What if we lock that down, as it were, with braces? What does that do to this entire system? Well, let's talk about that for a minute. We haven't talked about the fact that this system is a semi-closed hydraulic system. The fluid within it, just like the fluid on your hydraulic brakes in your car, okay, the fluid inside this system is cerebral spinal fluid. And it's a semi-closed system so that when there's production, which occurs in the brain, in pockets called the ventricles. When it's produced, there's a widening of the head. There's an expansion and a widening of the whole body. And as that fluid then begins to empty more, then it comes in to that emptying phase, so the bones of the head come closer together. Instead of widening, there's a narrowing. It occurs in the head, it occurs and can be palpated in the entire body. Well, if you change a bone and you make it so that these two bones in the upper jaw can't widen and narrow, what happens? Well, in the old days, when they put the brackets on, the orthodontist would put the brackets on. Sometimes the system was in expansion, and sometimes one side had already gone into the narrowing phase. So now we have two bones that are kind of out of sync. One's gone this way, one's gone that way. That can be a problem. So why do we need craniosacral therapy when it comes to braces? We need to be able to work with the individual, whether it's an adult or whether it's a child, to be able to soften up the tissue from the inside of the mouth, from the neck, from the entire system, to accommodate for the change created by the orthodontia. So we need to do craniosacral therapy in preparation for orthodontia. Every time the braces are applied or tightened, we need to do craniosacral therapy. And when the braces come off, it's going to be equally important to follow up with a few sessions of craniosacral therapy to make sure that the entire central nervous system is back in sync, the soft tissue, the bones, the membrane system are all functioning at an optimal level. We'll talk in our next section about how sometimes a scoliosis can even be induced from the old way of doing the orthodontia.